One of the most common questions that I get as a plastic surgeon is, what is recovery going to look like after plastic surgery? And one of the most common procedures that people want to know about is a tummy tuck recovery. For those of you guys who don't know me, my name is Dr. Megan Dreveskracht. I'm a board certified plastic surgeon in Seattle, Washington, and I do a ton of tummy tucks in my practice. So let's talk about what recovery actually looks like. First things first, what to expect on your body when you are coming out of surgery. So I can only speak for myself and how I do the procedure, but I typically do leave drains, which stay in for about a week. All your stitches will be on the inside. You'll have tape over your incisions, and we will put you in an abdominal binder afterwards. For the first couple of days, realistically, you are just going to be sleeping for a couple of hours, getting up, taking your meds, having something to eat, and then going back to sleep. At no point in your recovery, however, are you ever on bed rest. It's actually very important for you to get up and walk around, especially after a tummy tuck, to prevent blood clots from forming in your legs. Restrictions for the first 4 weeks after surgery are no heavy lifting, which is about 5 pounds per side, no arms directly above your head, which puts a lot of strain on your incisions, and nothing that's going to intentionally spike your heart rate and blood pressure because we don't want to get a bleed after surgery. Typically, by about 3 weeks, patients are feeling pretty good. So when they come in for that 3-week visit, that's a good time to talk about what to expect kind of moving on from week 4, when I relieve you of your restrictions, to week 8, which is typically when patients feel pretty darn back to normal. That 4 to 8 week mark is really when patients start kind of venturing into more activity to see how it feels. And it's really that ramp up period to getting back to normal. But it's not like you can't still cause issues when you're doing activity. So it's really about doing things smartly. When you get back to the gym, for example, doing things that are more upper body related or lower body related, as opposed to purely abdominal exercises, is really where you're going to want to start. At 8 weeks, your scars are as strong as they'll ever be. So technically there's nothing that could actually cause your incisions to come apart. So all activities are on the table at that point, but that doesn't necessarily mean even at 8 weeks out from surgery that everything is going to totally feel normal. Now, lastly, a couple of key points that patients usually want to understand before going into surgery. So average time on pain medication, I would say, is probably about 3 days, guys. It's usually pretty short. Once again, there is no point in your recovery when you are on bed rest. Most people wait about a week to start driving. Technically, you can start driving once you're off stronger pain medications, but you really want to make sure that you feel comfortable moving quickly if you needed to turn the wheel quickly. Most patients also take about 2 weeks off work. So when you're thinking about planning ahead, that's usually what you want to kind of think about in terms of jobs. So I hope this helps. If you guys have any questions about a tummy tuck recovery, leave them in the comments below, and I will do my best to answer them.